Yeah, hey guys, how are you doing? Aquaba. Medase. Yes. So today I will be talking about what an epidural is and side effects of an epidural. So stay tuned. The reason I decided to talk about what an epidural is and the side effects is because I see a lot of young women taking epidural, and yes, epidural type of pain relief, like pain medicine. People take medicine that also have side effects, but it's very low. But with an epidural has many side effects many women do not know, and I'll be getting into that with you guys in just a moment. So, what is an epidural? Well, an epidural is a type of medication which is inserted into the spinal cord. The goal of an epidural is to relieve pain. It relieves pain during pregnancy, so you wouldn't have to feel yourself giving birth to the child. But what you don't know is you're also not able to push during labor, which is very scary because you don't know if you're pushing or not, or you're pushing enough to bring the baby outside of your womb. Today I will be sharing 12 side effects of an epidural. So let's dive in. So the first side effect is low blood pressure. Many people experience low pressure during the moment of getting epidural. The second side effect of epidural is bladder control. So it returns back to normal when the epidural wears off and you're not able to know when your bladder is full or not to pee. The third side effect is itchy skin, especially where they injected the medication at. So where they injected at is in the spine, your spine area. So that spot becomes very itchy. Number 4, feeling sick or nausea. This is caused due to the low blood pressure. So you might be experiencing like yourself want to throw up or inadequate pain relief. So sometimes it does not, even though you take the injection and everything, it does not block all the pain. So you might still be feeling a little bit of the pain, even though you have epidural, which is very rare, but it's possible that you're still able to feel pain. Which many people know, back pain. So many women, this is very common. Many women that go through have a lot of back problems. This is because they're injecting something into your spine, first of all. And second of all, I say second of all, but no, for real. And second of all, it's medication. Like every medication has side effects. So your back will be hurting, and that's not during, child labor. It is sometimes, it can happen over later on in a year, 2 years, 3 years. Like it's able to come whenever it wants to. So yes, you might not get it now, but later on in life you can cause back problems. Headache. So with the headache, this can be caused when the bag fluid.
I got so many notes like I've put down, and I'm also like sharing with you guys in that way. So yeah, look at this camera. Doesn't want to stay up there. So this can happen when the bag of fluid that is surrounded by
your spine is accidentally punctured. Meaning if they insert the epidural in the wrong way, which happens sometimes, they have new nurses, old nurses that make this mistake, you know, you can go through headaches because they press the wrong, you know, thing in your back.
I'm not I don't work in the field, but you know what I mean. I know little stuff.
But yeah, so if the bag of fluid that is surrounded by your spine is punctured, it causes headache, because now this blood is flowing through your body instead of flowing through the tubes. So it's gonna cause nerve damage sometimes. And yeah, but let me not jump. Let me stick to, you know, stick to the strip. Another side effect, which is the 8th side effect, is slow breathing or drowsiness. This occurs in the hospital, and when this happens, they have to keep very close, like a very close eye on you to make sure like everything is going well, or not able to breathe, because your breathing changes, like it becomes very slow, like you're not normally breathing anymore. But it also can be treated easily, so that's not a harsh thing that comes with epidural. So slow breathing may happen to many women, but it is treated easily. Number 9, which I was talking about, temporary nerve damage. So with the temporary nerve damage, sometimes it causes loss of feeling or movement in your lower body. So in the lower body, you will not be able to feel anymore, which I was saying will be hard for you to push or know if you're pushing enough for the baby to come out. Some people go through temporary nerve damage for weeks, days, and sometimes even months, like months. Number 10, infections. So where they stick the epidural in can cause an infection if you don't take care of it. Other complications which are rare but possible. So you cannot just think you can take this off the list, because it is possible, it can happen. Pray over anybody who takes epidural that it doesn't happen to you, or if you're planning, if that's a way you want to go, I pray for you, and I pray that it doesn't happen to you. So one of the rare but possible effects is fits, which is the seizures people have when taking epidural. Another one is several breathing difficulties. So as you may know, I was telling y'all the slow breathing, but so different types of other breathing difficulties you could go through during pregnancy, getting an epidural. And the last but not least, death. So yes, epidural sometimes causes death, but like I said, if you're choosing this, I pray that none of this will cause death. Before you decide to have an epidural, I feel like you should discuss what you've heard and what you've looked up with the epidural with your doctor to see. Some women do get epidural during labor. Like sometimes it's not part of the plan, and sometimes people want to go natural, but the pain be so bad that you have to get the epidural. But if you get your mind, body, and spirit right, labor can be a fun thing. Like, it can be very exciting, and I hope everybody out there has a exciting and wonderful birth, because I know I am. I'm gonna make sure everything is right by getting my mind, so I have to prepare. If you're not prepared for labor, it can sometimes go wrong. So make sure y'all prepare for it. Don't just wait until it's almost time and think. It's like doing exercise. You just can't go to the gym and start doing the hardcore stuff. You have to build your way in to get to the hardcore stuff. So I hope y'all taking this into consideration. I hope that you speak to your doctor and make sure that everything is right. And yeah, I just pray every woman that gives birth in 2021 has a safe delivery and is protected, you know. So yeah, thank you guys for tuning in, and don't forget to catch my next video. Bye guys.